It's time now to get answers about COVID-19 from a local medical expert
who joins us every week, and we really appreciate it. Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health, with us once again tonight. Doctor, thank you for being with us.
Hi, guys.
So yesterday, the daily percentage of positive cases, that's new positive cases, compared to completed tests, it hit a low of 10%. That's a number that the state continues to say we need to look at this closely. We're going to determine a lot of things based on that. So what is that 10% signal, and what needs to happen now?
So I think, remember, one of the criteria for the gating to get into the next phase that we need a sustained reduction for 2 weeks of new cases. So hearing that percentage is going down is really important. But remember, as the weather warms and as we go outside, still important to try not to congregate and do the things that we know will spread this virus.
So let me dovetail off of that, Doc. So if the numbers move up a little bit today, is it yes, it's concerning, but is it overly concerning in the grand scheme of the slope that we're looking at?
I don't think so. Remember, we're also testing more. So sometimes when you're testing less severe cases, you may see the numbers go up. Also, we want to make sure that the hospitalization rate is going down as well, which ours is from COVID.
It is.
And that's at 5%, right? Okay, in a matter of hours, it's what, 4:40 now, midnight tomorrow. The governor's order on masks takes effect. Masks are required in public when social distancing isn't possible. Are masks the path forward to reopening our state?
So, Ed, I think it's one of the most important things that we're going to do, not just masks alone, but masks with good hand hygiene. But masks have actually shown to decrease the number of cases in some Asian countries. For a while, we were saying no masks, masks don't protect you, but it probably protects the person wearing the mask as well as the person that you are near. So I think universal masking will help us open up in public and the workforce as well.
I know it seems obvious, but I think it's worth saying exactly why. Exactly why, Doctor? How does that protect us and the people who are coming by?
And remember, it's easier to put our nose and mouth in lockdown than our whole body. So if you're containing the secretions, and it's all about viral load. If you're wearing a mask, there's going to be less virus that penetrates you, even if some of it can. So it's not just an all or none phenomenon. I think it's just another layer of barriers. And remember, social distancing is still important, even with masking, especially for the most vulnerable populations.
It is interesting because you definitely feel more confident, I think, when you put that mask on and you think, oh, you forget. It gives you this maybe false sense of confidence, but you're saying it shouldn't.
I think it's very important, but also remember, we can't touch our face as well. If we're always adjusting the mask, touching our eyes, it could actually work in the reverse. So we have to use the mask safely.
So earlier in this half hour, and we have talked in the last 24 hours about children. So while children largely haven't been affected by COVID-19, there are reports in New York, for example, that some are experiencing severe symptoms that include blood vessel inflammation. What do we know about this, and what symptoms should parents look out for?
Well, first of all, it's super rare. Kids do really well with COVID-19. That's the most important thing. But this unusual, what I call a mystery syndrome, probably has to do with a lot of blood vessel inflammation. It looks like something called Kawasaki and toxic shock syndrome. Kids can have low blood pressure. They can come in with a rash. They may have GI symptoms, and rarely they can have heart inflammation. It can be serious, but even with this disease, most kids do well.
Dr. Ellerin, it's great to see you. Thank you so much. Be well, my friend. Thank you for your time.
Thank you, Doctor.